So today we're going to be going over my CLS/aid bag from Spiritus Systems. So we'll start top to bottom, kind of discuss why, the way it's organized, and obviously what's in here. So like I said, Spiritus Systems, it's their aid bag. It's a pretty sweet aid bag. It's really small, but it does hold quite a bit. It holds what you need, right, to get through the march algorithm. So we're gonna start like on the exterior of this bag. So I got my trauma shears at the top, right, with a little keeper on them so I don't lose them, even though they are tethered here, so that I can use them and then lose them, right, so they don't run away. So that sits on top. Then I got two needle Ds on the side. These needle Ds, the seals are broke. This bag's kind of set up right now for training. So some of this equipment's expired and old, which it is what it is. Most of this equipment is still sterile. Obviously these are not. If a needle D is open, it can be used as a trainer, but it should go in the fucking garbage. In a sharps container, preferably. I mean, it is in a plastic case, but out of respect. Okay, so we'll start in the top compartment. We're gonna deal with massive bleeding, right? So we got 3 packs of combat gauze, and then we have 3 bandages, right? Or ace wraps, whatever you call them, for applying pressure, right? We get a pack. Pressure, direct pressure is important, but I also have a pack of S-rolled gauze as well, just regular S-rolled gauze with no clotting agents in it. And then I also have an Israeli bandage. Again, using this over the top of either compressed gauze, combat gauze, and applying direct pressure with this. Or I guess it wouldn't be direct pressure, but applying pressure onto the wound after you've applied direct pressure inside, on top of wherever your patient and the casualty is bleeding. So that's in my top compartment, right? That kind of covers some of the massive bleeding, right? Then we're gonna open this up here, this second one. We're gonna get in tourniquets. This is gonna stop the bleed. This is what you want. You're gonna hit this first, right? I'm gonna open that middle compartment if it's an extremity wound, and we're gonna hit it with a tourniquet. Tourniquets are the way to go. Tourniquets save lives. So Sharpie, marking time. That's what we like. We got to mark the time. So I have an IV start kit in here. I don't have fluids in here currently, but IV start kit and alcohol prep pads, disinfection. All right, so we got through that, right? Now we're gonna get into Airway. So I have an NPA, a kind of general size of 28. Fits most people, not all people. You can check by holding it from your ear. I believe it's your ear to your mouth, or maybe it's ear to nose. It'll get you pretty close to generally size somebody. I don't have lube for it, but you know, blood, spit, whatever, get it in there. I'm sure your patient would be a lot happier if they were breathing. And then we got chest seals, right? I got a twin pack of the hyphen vent. And then I also have some of these halo seals. I believe these are twin packs as well. But either way, we got 2 different options. I believe these are not vented. Yeah, I don't believe these are vented. So at least I guess I have 2 options. I can go with the vented. Obviously the vented is going to be better than a chest seal, like a closed off chest seal, because you got to vent that chest cavity. And then I also have 2 ancient needle Ds for training as well. I didn't even know those were in there. Well, these aren't that old. They've all been opened. This bag was set up for training, so it's a problem. Anyway, okay. So in your 3 front compartments, that's what you're getting, right? Pretty basic. This bag really needs to be filled, but it kind of gives you an idea of what you want to hit. So we hit massive bleeding. We've hit airway. And respiration. And cover the hypothermia in here, right? So your patient going into shock is going to be a big problem. So we do have a blizzard trauma blanket. Yeah, blizzard trauma blanket. Stopping them from going into shock is very important, and this will help. Even if it's very hot outside, the blizzard trauma blanket or anything to shield them from the environment is going to give them better odds of survival, right? So we also have 2 extra S-rolled gauze, another 2 Israeli bandages, as well as a SAM splint for splinting. Bless me, sorry. A SAM splint for splinting injuries, broken arms, broken legs, ankles, fractures, whatever it happens to be. You can also make a makeshift seat collar to support the neck, and then you could also make a pelvic binder out of this SAM splint, which is a pretty dangerous injury. Obviously, there's a lot of blood that flows through that area, so you need to stabilize for any type of pelvic injuries. So you can, with a SAM splint, obviously a pelvic binder is going to do a lot better than this will, but this can wrap around the torso, and you can use tourniquets to apply traction to your patient's pelvic area to hopefully stabilize it, so that when you do move that patient, because you are going to have to move that patient at some point, that when you do move that patient, they're going to be stable, and that's not going to shift their pelvis, causing internal bleeding, which you cannot solve in the field for extended field care. Obviously, this bag is not set up for that. This is to get you to an evac and get you to a hospital. That it will do. But pelvic injuries are probably one of the most common injuries, and the hardest to deal with. It's going to be difficult to move a casualty with pelvic injuries. You probably shouldn't, if at all possible, to not move them. But if you're doing care under fire, that's one of those things you're not going to be too concerned with. You're just trying to gain fire superiority and get them off the X, get them out of harm's way, and then deal with it. So do what you can, obviously. So that's kind of what this bag is built to do, is get them the help they need to live in the short term, so that you can get them to medical professionals to do their job. They will. You're going to be better off serving them a stable patient. So that's kind of how this bag is set up. Obviously, there's a lot more that could be in here. Should probably put fluids in here. That would be awesome. That's one thing that's really important, is fluids. Because if you have a GSW and he needs blood, or lactated ringers, or whatever, to replace what he doesn't, or what he has lost, or try to help his body replace it. Fluids are going to be important of all kinds. So, but obviously blood most important. So if you have guys in your team, and they share a blood type, and you think that you might, or you have the ability to draw blood beforehand, and keep blood with you before you go out on a mission, that's going to be very, very important. You can do it. It's really easy to learn. Take some courses, take some classes, or just make sure you're trained medical professional before you go ahead and start drawing your buddy's blood, because it could be dangerous. So just think about those things when you're building something like this. Being able to do a blood transfusion, drawing and storing blood, how long blood lasts, how long your fluids are going to last, how to check when stuff's bad, and going through your bag regularly to make sure that everything is up on expiration date, or that it's not up and ready to be replaced. So be able to be ready to change out and swap in an expensive bag to keep. Obviously this right now, It's pretty much a training bag, so it doesn't have a lot of expensive stuff in it besides the combat gauze, which is spendy. And obviously tourniquets don't really go bad unless they're being used or they're getting old and weathered from being on the exterior, but these are all brand new sitting in a bag, so they should never go bad. All right, guys, that's all I got for you. Leave a comment, like, subscribe, and I will see you in the next video.